my turn, but it's really good. Like you already spoke about so how the school education should be, and how it should be properly taken into the next level as a higher education, and what kind of support the government should come forward to bring changes or upgrade the research and development, as well as the higher education system in India. Thank you very much. And yeah, so now we have the next speaker, one of the co-organizers of this today's evening meeting, Dr. B. Ramanathan, founder and managing director of ACE International Private Limited, Singapore. And he has a PhD in biomedical sciences. He has been to several countries, he has traveled to Japan, Taiwan, and now he is settled down there in Singapore, and he is involved in various kind of things, he's into entrepreneurship training program, and he's providing lots of skill-oriented programs, and also he's organizing various other programs related to develop the society in a sustainable way. So that is more important. He can touch any kind of aspect which is going to help the society to come up, also bring changes in everybody's life. That is more important and just more beautiful. And with that, I would like to welcome Dr. B. Ramanathan, founder and manager of ACE International Private Limited, to give his talks. Welcome, sir.
Thank you, Rajesh Kumar, Dr. Rajesh Kumar. It is a wonderful opportunity to join with you to conduct this particular fabulous program to celebrate 75th Independence Day of India. We are very happy, and we are very privileged for hosting this session along with Art of Giving as well as ACE International Singapore. Thank you so much for organizing it. And I would like to start from my slides, because already the people, they have done great job, Dr. Kabali Subramanian and Professor Sudhakar. So my part, I have to cover up very well for you to think about your health and wellness, how to embrace for the current scenario. Slide is visible?
Yes. Yes, sir.
Thank you so much. As we are all Indians, and we are all celebrating the 75th Independence Day of India. So it is the time for us to nourish and cherish about the health and wellness. How do we able to embrace in the Indian continent? That is the wonderful thing, and we are all having our good focus on maintaining the health as well as the wellness for ourselves as well as our family members and kids and kin. So India is having nearly 130 crore populations, and it is a difficult task for making the people to keep the good health and wellness. But we can able to think how do we able to formulate certain kind of strategies as well as plans which can support well for the people who can able to follow good health and wellness kind of practices. Myself, Dr. B. Ramanathan, I am the founder and managing director of ACE International Private Limited, Singapore. India is now focusing more towards the 2030, how to establish the future cities in 2030, that is the world's largest mega city kind of thing, especially for the smart city. Smart city development is going on everywhere all around the world. How to incorporate the facilities which are going to support for the community who want to take care about the people as well as the culture. That is the very important aspects. So we can able to think how do we able to formulate certain kind of ways how to lift up the health and wellness scenario in our population as well as the community level approach. 25% of Indians are getting died before when they are achieving 70 years old. This is the study taken by Times of India, and it is a kind of alarming for us to think about the chronic diseases like cardiovascular, diabetes, respiratory disorders, cancer, any kind of injuries. That is the way we have to think how do we able to avoid the chronic conditions which are going to make ourselves the endangered kind of things to achieve the death status. We have to think about the lifestyle diseases. As of now, we are getting the modernized environment where we are not remembering, as well as sometimes we are ignoring the lifestyles which are going to make some kind of worse condition for the people who cannot able to take the certain kind of risk reduction or risk avoidance. This is very much related to the people who are getting affected by below 45 years of old, especially the diabetes, high blood pressure, high cholesterol, as well as neurological disorders, heart diseases as well. Indian healthcare, we have to focus very well for 2030 and beyond. We have to formulate certain kind of strategies which are going to add on value for our existing healthcare perspectives as well as practices. We must need to adopt certain way of modern technical technological procurements to embrace the opportunity how to lift up the better healthcare services provided for all the people. Current medicine is one kind of treatment fits for one treatment fits for all, but it is not the way to work out. So the future medicine more personalized manner. It is preparing the diagnostic methods in order to diagnose every individual in the community and categorize them to suitable for the correct therapy. That is the way we have to think and prosper well to make the effective therapies and the conditions to treat well. Personalized medicine must need to aid for certain kind of things, especially early detection is the better one, and faster and precise diagnosis are mitigating because during this COVID-19, because of the faster diagnosis only we can able to detect the better conditions, whether the patients are positive or negative to the COVID-19. That way, we can offer the personalized treatment very effectively for those who are getting negative to go for the further treatment. In the past, the same time, the drug is getting widely covered, but nowadays, the personalized medicine is very much focused for those people who are categorized in the negative condition. They have to formulate certain kind of therapies and medicines which are more effective for the individual level. That is the way the futuristic medicine is journeying through, and we can able to think about the prevention is better than cure. How to find out the early detection for the patients who can improve the preventive measures to get rid of this kind of disease pattern, and better diagnosis also, that is making the accurate diagnosis report, that is making the people who can able to treat well, and that kind of individualized treatment is more effective as of now. Improved outcome through the strategy as well as the targeted therapies are very important. We are now focusing towards with this kind of improved version of therapy methods which are giving very little side effects or no side effects. Personalized medicine in India, there are few companies they have come forward and they have established the healthcare kind of support, especially Positive Bioscience with Medanta, India's first personalized genomic clinic. They have started up with Xcode Life Sciences in DNA technology. That is the coronary diabetes kind of treatment. They can able to suspect early in stage, and they can support for the human to get rid of these kind of risks in the future. As of now, India spends just 1.4% of the GDP on health. It is very much alarming for us. This is very lesser than other neighboring countries like Nepal and Sri Lanka. We need to understand about the policy, how to make it for the right moment. As earlier speakers also pointed out, we have to work on it. Health expenditures per person, it is very, very difficult as of now. Among the BRIC countries, India is very much lower in spending their expenditures per person for the healthcare perspective. We have to improve our strategy, how to lift up, how to spend effectively for the better therapy as well as medicines reach to the individual. We have to compare the public as well as private healthcare sectors. When compared to the public, private health sectors are 4 times higher cost effective, and we must need to think how to balance between the public as well as private healthcare effectively affordable for many people, because we have different range of people who can able to afford by themselves, who cannot able to afford by themselves. So we need to balance between these two different region of people, especially in the people who are living in the rural areas as well as in the urban areas. Health insurance also very important. India has given many health insurance policy. Government has provided for the people who are using this health insurance for their betterment to go for any therapeutical values available in the private hospitals as well as public hospitals. That is the way we have to plan for critical illness, some kind of coverage for the senior citizens, as well as the maternity plan for the people to work well. We must need to think how to lift up, because domestic health spending per person India is in the very lower range. So we have to work on to improve for these kind of expenditures to support for the people who can able to afford for better treatment. We must need to plan our medical treatment by consulting with the right people. If we want to travel any other places in the local region as well as abroad, we must need to embrace for that. We have to get the best health perspectives and the treatment therapy which are available in the local manner, because regional manner there are some restructured hospitals available in the private sectors as well as government sectors. We must need to use those kind of facilities for our better treatment or therapy methods to adopt. Among the country like Thailand, Indonesia, India is still very lower to compare to the cheap medicines available for the people. These are all the areas we have to focus how to improve the strategy. It is getting validated for Indian atmospheres, especially even the poor country like Thailand or Indonesia also doing great for their people. It is the time we have to embrace for the integrated and holistic medicines and medical therapies. We have our traditional wealth, knowing many things about the drugs which are naturally available, extracted from the plants or any other products from the natural sources. We must need to think about the curative medicines, alternative measures, any kind of preventive measures, because we can take the food as a drug. So every day our Indian food is containing certain kind of value addition for the medicinal products which are providing the sustainable support for the health in our body. So that is the way we must need to think, and we can able to go for allopathy when it is the need of time or doing some kind of surgery or any kind of emergency medicines requirement. We can able to use those kind of allopathy system. This is the flowchart explaining Indian system of medicine. We have the Indian traditional medicine, which are very well developed, the historical practices and the wealth of knowledge sources. We can able to select and identify various kind of new drug, identifying new drug formulations which are effective for the people to get rid of anti-aging or chronic diseases. That way we can go with the modern screening like high throughput screening or any kind of in silico methods to find out the therapeutic potential drugs, and we can able to conduct certain kind of clinical trial to go for the applications. That is the way we have to raise up certain kind of evidence-based therapies, evidence-based medical ailments which are available for the people to work well and prosper well. Why medical tourism to India? We should think about that, because we can able to provide in low cost manner, and we can able to provide the quality healthcare for the people. We can conduct the personalized medical services that is also attracting the global medical tourism people to come over to India. That is the way we can improve the great wellness that is especially pointing towards the tourism development. We have naturotherapy hospitals in India. It is very much formulated for the integrated holistic medical therapies. We can able to use these kind of integrated holistic medicines which are going to support for the curative effects for people who can get rid of their diseases. How do we able to do that? Because holistic therapy is pointing towards with the mind, body, and soul. The approaches which are covering for some kind of counseling methods to know about the conditions of the people, whether it is affected through the physiological or psychological or any kind of physical environment. That is the way we can able to sort out. We can practice various kind of therapy like psychotherapy, gestalt therapy, art therapy, breath therapy, hypnotherapy, and guided imagery therapy. Some kind of imagination you can create the positive attitude for the people to get avoidance from the disease impact. There are few forces which are driving effectively for the new payment model, especially for the compliance and regulatory, which are governing for the people to spend for the medical expenditures. That way, we can able to strategize the payment methods, which are very much supported for their better healthcare practices to adapt. We must need to think about the patients as well as citizens who can able to procure the right therapeutic methods when they are working in the companies. There are policymakers who can able to prepare the policy which are supporting for the people, for especially for the medical treatment, and we can educate our people how to conduct the proper way of doing this kind of clinical trials and other ailments which can make the new novel drug, and it is also supporting for the people. We can attract more investors to come and invest in this particular segment. India has tremendous wealth of knowledge, as well as it can able to attract the global investors to come and invest, especially in the healthcare sector. As per dimensions of the wellness, we can able to categorize six major categories: environmental dimensions, emotional dimensions, intellectual dimensions, physical dimension, social dimension, and spiritual dimension. How do we able to think of the wellness to get curative measurements through these different dimensions? We can formulate three circle like a micro circle, meso circle, and a macro circle. We can able to embrace the available sources in the micro, meso, and macro environment to touch upon with various kind of aspects to cover well for the better therapies or medicines. We can able to go with Ayushman Bharat. That is the new formulation by the government. They are proposing for various kind of treatment, especially screening and managing the healthcare products as well as healthcare treatment, and how to embrace for the care for different sectors in the community. It may be childhood health, or it may be adult health, or senior citizen kind of health perspectives. Ayushman Bharat is supporting for comprehensive primary health care for the care people, and it is also formulating well for health and wellness centers available all over the world, all over the country. That is providing the better treatment efficacy for the people to procure from the nearby places. We must need to focus for the patient-centered care. How do we able to use the values which are getting aligned for the personal value of the patient? We must need to care about the collaborative or coordinated kind of knowledge sources which are available all over the Indian side. There are many research centers and institutes, as Professor Sudhakar mentioned. They are doing more translational medicine kind of supporting things. So we have to adapt those kind of things, how to support for the wellness kind of practices. Public health care in the infrastructure in India, especially they are covering three major categories: community health center, primary health center, and sub-center. We can able to think of that, how do you able to use these kind of available facility in our nearby places. Healthy lifestyle is the maintaining the good health for everyone. If you are focusing on your health, you must need to be very active and engaging your life very good by way of eating healthy food and a healthy environment to support for your betterment. If you are thinking about overweight, you have to go for the practice to go adapt with a different kind of exercise. Either you can go with the consulting with physicians, or you can use the gym practices to reduce your weight, because obesity is the chronic diseases we have to focus on it. As now the digital era is supporting a lot, especially for the data concentration, data processing. The patient's data are segregated and aligned together for data acquisition. That is the way the artificial intelligence is intervening with the data sources to find out the concepts or conceptualizations which are very much focused for better treatment for the people. top 5 digital healthcare providers in India: Manipal Hospital, Apollo Hospitals, Artemis and Fortis, and the Institute of Medical Science. These are all having the facility to manage effectively for the available digital data sources. And there are artificial intelligence induced healthcare companies. They are getting more funded, especially they are intervening a lot of data, and they can able to create more new concepts and novel therapy methods. So that is the way we can able to formulate the futuristic medical conditions in our country very well. India needs affordable medical solutions and medical fees. What does the future hold for home healthcare in India? So we have to focus very well. Recently in Tamil Nadu also, the Chief Minister has started how to reach to the home to treat well for the people who are referring these kind of facilities. That is the way we must see futuristic aspects, especially this one. What is the feature for healthcare? We have to categorize the 4 quadrants. Personalized medicine is one kind of support, and the tech frustration. We have a lot of technology available all over the world, but how do we able to use those kind of technology to our environment is the critical thing. We must need to formulate certain kind of regulatory compliance things, how to adapt well for, because in future robotics are going to do the surgery, and many more artificial intelligence sources are going to support for the people to predict the basic medicine service for the conditions. And how do we able to fit for these kind of facilities overall the populations, irrespective of their range, to afford for the medical condition? Thank you so much for patiently listening to my talk, and we can be able to focus for the futuristic medicine very well supported for all people in our country. Thank you so much. Over to Dr. Rajesh.
Thank you, sir. Thank you very much for giving a good idea about so how health and wellness it's in India, and also you compare all those data with other countries. It's really good. Hope so already I believe India already having affordable medical facilities when compared to other countries. Since actually I've noticed many of the foreigners, they used to come to India for taking a better treatment when compared to other countries, and also it's affordable. And it is known that Chennai is the hub of medical hub of India, the biggest hospitals like Apollo and Neot, and there are plenty of hospitals. They are giving a very good treatment at very cheaper cost when compared to especially America or European countries. It's really good to know so how India is moving forward in medical treatment, and also what are the opportunity for us to get into the kind of medical tourism. That is more important, because medical tourism are the biggest business sector, where many entrepreneurs could come forward and they make lots of profit through medical tourism. And thank you, sir. Thank you very much.
Thank you.